Mr. Gonzalez. How are you doing today?
I'm good. How are you?
Good. My name is Nicole. I'm going to be your nurse today. Can you please verify your full name and date of birth?
My name is Jeremiah Gonzalez. My birthday is June 4th, 2000.
Okay, and do you have any allergies?
I do not.
Okay. So today we're going to do a physical assessment. I'm just going to be looking at you from the top of your head down to your feet. It should take about 15 minutes, and it does require me to touch you. Is that okay?
Yes, ma'am.
Okay. Do you have any questions for me?
I do not.
Okay, perfect. Okay, so the CNA was able to assess your vital signs. Blood pressure 128/82, respiratory rate 15, heart rate 76 beats per minute, and your O2 stat was 97% on room air, okay? Are you experiencing any pain?
I'm not.
Okay, perfect. Okay, so I can tell that the patient, just with speaking with him, that he is calm and cooperative and does not appear ill. I'm going to ask you some funny questions, okay? Do you know where you are?
I'm at the hospital right now.
Okay, and do you know what day of the week it is?
It's Thursday.
Okay, and do you know why you're here today?
To get a physical assessment.
Okay, perfect. So the patient is alert and oriented times 4. Okay, so I'm just going to perform hand hygiene. I will don clean gloves, and then I will sanitize my stethoscope. Okay, perfect. So just by looking at his skin, I can tell that his skin is intact. His color is appropriate for his ethnicity. I don't see any scars or lacerations, which is great. I'm just going to feel you really quick. Okay, perfect. I can see that his skin is warm to touch and dry, which is great. Okay, and no signs of cyanosis as well. So next I'm just going to be palpating your head. I don't feel any masses, I don't feel any lumps, I don't feel any lacerations or bruises. His hair is evenly distributed and with his skin intact. Okay, next I'm just going to be looking at your ears. Perfect. Perfect. Okay, so I don't see any inflammation or drainage or redness, and I would note that the patient has bilateral ear piercings on his earlobes. I'm going to look in your nose. Perfect. I don't see any inflammation, drainage in his septum, his midline. Open your mouth for me. Perfect. I can see that his mucous membranes are pink and moist with no redness, no bleeding, and normal dentition. Okay, so next I'm just going to be looking at your neck and palpating his neck, feeling around. I don't feel any masses, lumps, or bumps. I'm going to be feeling his trachea. His trachea is midline, and his thyroid is not enlarged with no void or nodule, which is perfect. Okay, so next I'm just going to be palpating your lymph nodes, preauricular, post-auricular. I have your occipital. I have your parental pharyngeal. I have your submaxillary, your submental, and your supraclavicular. Okay, his lymph nodes are non-palpable, which is great, so no sign of infection. Okay, so next I'm just going to be looking at your neck again. Can you turn to the side for me? And the other side? Perfect. Now, JD, you noted his central venous pressure is normal with so no fluid overload or signs of congestive heart failure. So next I'm just going to be listening for bruits in your carotid artery with the bell of my stethoscope for 1 minute. Okay, I don't hear any bruits, which is great. Okay, so next thing I'm going to do is I'm just going to be comparing your carotid pulses to your apical pulse, okay? Okay, apical pulse is going to be at the 5th intercostal space on the left side, midline to the clavicle. So I'm going to do the right side. Perfect, now the left side. And perfect. Okay, so his carotid pulses are bilaterally equal to his apical pulse with a 2+ with no pulse deficits, which is great. Okay, next I'm going to be having you sit up, please. And can you close your eyes for me, please? All right, perfect. Can you close your eyes and tell me what you smell?
Me.
Perfect. Okay, and so cranial nerve 1 is intact. So your Snellen chart was completed prior to your assessment, and the result was 20 out of 20, which is perfect. Okay, so cranial nerve number 2 is intact. So next I'm going to be assessing your cranial nerves 3, 4, and 6. Can you look straight ahead for me? Perfect. Pupils are about a 4 and bilaterally. His pupils are parallel, which is equal, round, reactive, and accommodate to light. Okay, next can you follow my finger? Try not to move your head. Perfect. All right, so patient 6 cardinal fields of gaze are intact. I don't see any nystagmus, which is great. Okay, so next thing I'm going to be doing is, so 3, 4, and 6 cranial nerves are functioning well and are intact. So next I'm going to be assessing cranial nerve number 5. Have you had any changes in your taste or hearing lately?
I have not.
Okay, and can you raise your eyebrows, puff your cheeks, smile? Perfect, and can you try to squint and try to open them, please? Perfect, okay, so cranial nerve 5 is intact. Can you move your jaw for me? Up and down, and forward and backward. Perfect, cranial nerve number 7, his DMJ is intact as well. So next I'm going to do cranial nerve number 8. Can you cover your left ear for me? Perfect. Can you repeat back what I whispered?
Purple.
Next ear, please.
Yellow.
Perfect. Okay, and can you stand up for me, please? Feet together, hands by your side, close your eyes. I'm going to be assessing for a full minute. Okay, I don't see any swaying or loss of balance, which is a negative Romberg, which is great. You can sit back down, please. So cranial nerve number 8 is intact. That's great. Okay, so next I'm going to be doing assessing 9, 10, 11, and 12. Have you had any? Do you have any trouble swallowing?
No.
Okay, so no dysphagia noted. Can you stick your tongue out, side to side? Perfect. And can you shrug your shoulders? Perfect. Can you do arm resistance, please? Okay, patient can shrug shoulders with full resistance. Can you move your head to side to side? Perfect. Okay, can you stand up for me? And can you walk in a straight line towards me, please? Perfect. Okay, you can sit back down. And can you shadow me, please? Do this. And then your heel down to your shin, please. Up and down. Perfect. Next one. Awesome. Okay, so upper motor and lower motor neurons are intact, which is great. Okay, so next I'm going to be assessing the patient's chest. I would ask him if it would be okay with him if I can expose his chest, but for the sake of this video, I'm not going to do that. So I can see that the patient's skin color is normal for his ethnicity, like as mentioned earlier. I don't see any scars, lacerations, or bruising, which is great. I'm just going to slightly touch. As mentioned earlier, his skin is warm to touch and dry, which is great. Okay, next I'm going to be assessing his skin trigger. I'm just going to be pinching right here. Okay, patient has normal skin trigger, so no signs of dehydration, which is great. Okay, so the next thing I'm going to be seeing is his thoracic cage is symmetrical. I see that his muscle development is normal for a man his age, which is great. And I can see that his chest configuration ratio is a 2-to-1, which is normal finding. Okay, so next I'm going to be palpating for respiratory expansion. Take a deep breath in for me, please. Okay, perfect. So the patient's chest expansion was symmetrical and he has equal rise and fall. I can also see that his respiratory effort is normal. He has no accessory muscle use, no signs of respiratory depression, and he has a normal pattern and rhythm, which is great. Okay, so next I'm going to be listening to your breath sounds. So I'm going to be listening to 6 points in the front, so the anterior portion of his body. So take a deep breath in for me every time I move my stethoscope, okay? Perfect. Now I'm going to listen to 2 points on his lateral side. Perfect. Next I'm going to listen to his posterior portion of his body, so 8 points here. Perfect. So I can hear that the patient does have clear lung sounds in all 5 lobes of his lungs, which is great. No adventitious breath sounds such as crackles or wheezing, which is great. Okay, so next I'm going to be listening to your heart, okay? All right. So I'm going to be listening to his aortic valve, which is going to be at the second intercostal space on the right sternal border, where S1 is greater than S2. Next, I'm going to be listening to his pulmonic valve, which is on the second intercostal space, left sternal border, where S1 is greater than S2. I'm going to be listening to Erb's point with the bell of my stethoscope. On the third intercostal space, left sternal border, S1 is equal to S2. And his tricuspid valve, fourth intercostal space, left sternal border, where S2 is greater than S1. And his mitral valve, which is the fifth intercostal space, left sternal border, where S2 is greater than S1. Perfect. And can you lean slightly forward for me? Okay, and I'll be listening to his apical heart rate for a full minute. Perfect. Okay, so no murmurs were heard in all heart regions, which is great, and his apical heart rate was 75 beats per minute, which is perfect, okay? Okay, so next I'm going to be assessing the patient's upper extremities or his arms. So I can see that his skin, I don't see any scars, lesions, or bruises, which is great. I'm going to assess his temperature once again. Perfect. I can see that his skin is warm to touch and dry, which is great. And next I'm going to be assessing your brachial and radial pulses. So I'm doing this arm first. Perfect. And then the arm. Perfect. So his brachial and his radial pulses are bilaterally symmetrical, which is great. And it would be a 2+, which is normal. Okay, so next I'm going to be assessing your deep tendon reflexes. So I'm going to be hitting his tricep, his bicep, his brachioradialis, and since the patient is already sitting up, I'm going to go ahead and do his patellar reflex as well. Ideally, the patient would be sitting with his legs dangling. Okay, next I'm going to be doing the other side as well. I'm going to do tricep, bicep, brachioradialis, and patellar on this one as well. Perfect. Okay, next I'm going to be assessing joint range of motion. So can you put your arms out like this, put them back in for me, and can you flex at your bicep? Perfect. And then can you rotate your wrists? And the other way, please. Perfect. Next, I'm going to be assessing his muscle strength. Can you have your arms out like this? Press up for me. And press down. Perfect. And can you grip onto my hands and squeeze them as hard as you can? Perfect. Okay, can you put your hands out like this? Straight out, please. And then can you push for me? And push back? Alright, perfect. So his muscle strength is normal with full resistance, so that's great. And then I'm going to be assessing his capillary refill. Okay, his capillary refill is less than 3 seconds, which is great. Okay, next I'm going to be assessing the patient's abdomen. So I would have the patient expose his abdomen. I would ask him if that's okay first. So upon looking at his skin, I don't see any abnormal bruising, any scars or lesions, lacerations, which is great. I don't see any signs of ascites or hernias, which is also great. And I don't see any abdominal distension, which is also good. Okay, so sir, can you tell me when your last bowel movement was?
About 2 hours ago.
Okay, and can you describe the color and consistency? Was it soft or solid?
Soft and brown.
Okay, perfect. And when was the last time you urinated?
About an hour ago.
Okay, and can you describe the color for me?
Like translucent yellow.
Okay, perfect. And was there any specific odor coming from the urine?
Normal odor sound or urine smells.
Okay, perfect. And then, did you have any trouble urinating or experience any pain?
I did not.
Okay, so patient has no urinary retention and no signs of a UTI, which is great. Okay, next I'm just going to be listening to your stomach. So I'm going to be auscultating on bare skin. I'm going to be listening to his right lower quadrant, his right upper quadrant, his left upper quadrant, and his left lower quadrant. Perfect. And I would be listening for a full minute in each quadrant. And if I did not hear active bowel sounds, I would be listening for a full 5 minutes in that quadrant. Okay, so sir, you're active. You have active bowel sounds in all 4 quadrants, which is great. So next, I'm going to be listening for bruits in his abdominal arteries. All right, no bruits noted. That is great. Okay, the next thing I'm going to be doing is assessing the patient's lower extremities or his legs. So just by looking at his skin, I can see that there are no scars, there's no lacerations or bruises, which is great. And next, I'm just going to check for edema. So I'm going to press down. Okay, and on this other leg. Perfect. All right, so there is no pitting, which shows that there is no edema, which is great. And I don't see any viscosities as well. Okay, so next thing I'm going to do is I'm going to assess his range of motion. So can you put your leg out for me like this? And in. And can you bring your knee to your chest for me? Perfect. And can you do your other leg, please? Out and in. Perfect. And can you bring that knee to your chest? Perfect. Okay, so the next thing I'm going to be doing is I'm going to be assessing his muscle strength. So can you press up on my legs? Perfect. And then can you press down for me? Perfect. And then can you press down on my hands? And then press up. Perfect. So the patient was able to press down on my hands with full resistance, which is great, bilaterally. So next I'm going to be assessing his pulses, so his dorsal medius. Perfect. All right, those are bilaterally equal to 2+, which is great. And his posterior tibialis. Perfect, and those are bilaterally equal as well with 2+. Okay, next I'm going to assess his capillary refill. All right, and I do see that is less than 3 seconds, which is perfect. All right, Mr. Gonzalez, we are all done with your physical assessment. Do you have any questions for me?
I do not.
No. Okay, so here's your call bell. If in the case you do need me for anything, please press that button. I'll be back with you, okay?
Okay.
All right, so then next I would perform hand hygiene as always, and I would sanitize my stethoscope to ensure infection control. Thank you.